Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle Live in studio. It's a pretty day outside, a little cool, but nevertheless, it's one of those days that you'd like to get out and relax a little bit. Guess what? We're here for you. If you had a problem, you've tried, you've applied, you've done the same old, come up with, nothing that works, well, that's why we're here, and that's why we do this program every Sunday at 12 noon. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you. Like to clear whatever confusions that you have about your health. Remember that your health is a do-it-yourself program, and we're supposed to give you the information on how to do that. We've got a very special topic for you today, something that a lot of people have heard about, but a lot of you really don't know what it is and how extensive the problem is and the manifestations within the body and so forth. But you know what? When we have a very diverse topic, I have somebody, always an expert, to help me discuss it with you. My guest in studio, Dr. Michael Chung, who you've heard before, and we're going to be talking about temporomandibular joint dysfunction, and the area of specialization that Dr. Michael has is called neuromuscular dentistry. Anyway, I'd like to welcome you. Hi, Dr. Michael.
Thank you very much, Dr. Roselle.
We're going to have a little kind of unveiling, if you will, of people who have sore spots in their head and their face and their body, their arms and their hands, and have tried everything generally, and nothing seems to work, nothing goes away, but it's still there. And then, they come into my office, and I look at them and I say, you know what, you got a problem with your mouth. And they look at me, I have a problem with my mouth. I said, yeah, you got a problem with your mouth. It doesn't close properly. It sits in a really lousy position, so now that's why you got your headaches. That's why you can't see the way you're supposed to. That's why you got these sharp pains that go into all kinds of regions of your body. But anyway, I can go on and on, but that's your area, so we're going to talk about that a little bit. Dr. Michael, let's talk about really what the terminology of temporomandibular joint dysfunction means. What's that all about from your perspective?
Well, it's usually misalignment of your joint, and it can cause all sorts of symptoms, as you know, headaches, pain, muscle spasms. It's just basically a misalignment of the joints.
So, we all open and close our mouth all day long, and we see some mechanical deviations of different people. You look at somebody open their mouth and it shifts to one side. You look at another person and they close and their mouth moves forward a little bit, and some of them want to sit there and they grind their teeth, or they clench their teeth, pretty much like me, and do that on a regular basis. As a matter of fact, to the point where I've destroyed a couple of my upper back teeth because of that. But this can be far-reaching. It can the symptom processes, the inability to resolve issues. In addition to that, the destruction of the mouth, the destruction of the teeth. How do TMD, temporomandibular joint dysfunction, joint problems, if you will, how do they come about? What are the causes? What's the underlying stuff that makes this happen?
Well, it's basically the muscles, the teeth, and the joint. They kind of function together harmoniously, and it's usually one of the three that could be out of alignment, and a lot of times it's usually the teeth, the upper teeth and the lower teeth, the jaw, when they're forced to close in a certain way and they're not lined up properly. Now, it puts a lot of stress on the joint, and also the muscles have to work extremely hard so that they are basically accommodating for the faults of misalignment, and it can cause all sorts of problems, as you know.
Well, temporomandibular joint dysfunction is something that we look at, and I think you and I had talked about it a couple of times. We know that there's a homologous relationship between different parts of the body, and the temporomandibular joint and the sacroiliac joint, low back, work together. If you put somebody on a treadmill and you put thermistors, one on their temporomandibular joint on their face and one on the sacroiliac joint, and you watch them on scope, and what you would see is that one fires, the other one fires. One compensates in movement. So a lot of people with low back pain, sometimes, particularly when they say, I don't know how that happened, it's a result of a jaw problem. And I, unfortunately, often will disparage the dental profession. Not you, because your work in neuromuscular dentistry is very unique. But when guys out there are putting dentists out there, and they'll forgive me, but when they put crowns in place, they put caps in place, they put jackets in place, they put they're doing dental work. They don't get a good vertical approximation of the TMD, or the vertical dimension of the jaw generally, and now you get all kinds of shifting of the teeth. And you're laying on your back, and here's the way I describe it, and you can tell me whether I'm full of hot air or not. You go to the dentist, and he puts in a new filling in your mouth, and you're numb. And he takes a little carbon paper, and he says, tap, 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 right? He says, how does that feel? How the heck do you know how you feel? You're numb. You can't feel anything anyway. First of all, he does it on your back. Second, you can't feel anything. And we live in a vertical dimension. We live standing up or sitting up, not laying down. So when you lay down, the jaw goes backwards. It drops back.
That's correct.
So you're not getting good vertical positioning. So that's how, in my opinion, a lot of this stuff happens. They cut them too short, or they leave them too long.
That's correct. Obviously, your lower jaw is hung by bunch of muscles, and they can move in any different direction. And if you lean back, obviously it's going to fall back. And if you tilt your head to the left, it's going to tilt to the left. And unless you check the occlusion with your head nice and level to the ground, you're not going to get the perfect bite position. And if your bite is off because of one filling or one tooth, it's going to make you accommodate. It's as if you were forced to walk with a little pebble in your shoe on one foot. If you have to walk a mile that way, eventually, because of the pain, you'll figure out a way to walk without hurting yourself, but then you're going to accommodate other parts of your body, which will stress that area and have problems there.
We're talking about temporomandibular joint dysfunction, or TMJ or TMD, and in studio to help me talk about that is Dr. Michael Chung. Dr. Michael works in Oakton, Virginia. He owns Soft Touch Dental. And by the way, if we're sitting here and you really said, I really have a problem and I want to get this checked out, Dr. Michael has been very courteous. He's very kind, and he has made an offer for all Dr. Tom Roselle's listeners. And what that is simply this. If you would like to see Dr. Chung to find out, in fact, if you have a problem, if you have a mouth that's kind of messed up a little bit, he will consult with you at absolutely no charge whatsoever. That's free, nothing, zero, nada. All you have to do is give him a call, 703-319-6990. That's 703-319-6990. SoftTouchDental.com. It's SoftTouch dental, DENTAL, dental care. We got to talking. I'm already changing it for you. So it's SoftTouchDentalCare.com. Now, I want you all to know something. I have tremendous respect for Dr. Chung. Dr. Michael is one of the best, in my opinion, out there doing the type of work that he's doing. And we're going to talk about that in a second. We're going to talk about neuromuscular dentistry, what that really means, how that relates to the temporomandibular joint, and they all kind of work together. Dr. Michael's been educated at LVI, which is Las Vegas Institute, which I have tremendous esteem for the practitioners that are coming out of there. They truly understand the neuromechanics of the mouth, head, and neck area, much more so than anybody else does, and how they're interrelated and integrated. So let's jump into that. And we have callers that are coming in. I'm going to take them, so don't go away. Kind of hang in there. But if you'd like to talk to us, 888-630-9625. That's 888-630-9625. What is neuromuscular dentistry? What does that mean? I mean, it's a big term. I mean, people say, yeah, so what? He's a dentist, is a dentist, is a dentist. Not so much. What is it?
Yes. Usually, if you see a general dentist, they will focus on your teeth and your gums, and they will take care of whatever the problem is that they see. Neuromuscular dentistry goes to another level. It's basically a three-dimensional dentistry. It's teeth, it's the muscles, and it's the joints. All three of those are just as important to have optimum function and performance. So hence neuromuscular dentistry versus just focusing on the teeth and gums.
You do an incredibly interesting examination, which I was blown away the first time that I saw it. And part of that examination process is something called a K7. And that's, you're hooking people up and so forth. What are you doing with a K7? So our listeners can understand the uniqueness of this evaluation process.
Well, K7 is a very sophisticated computer program that was developed so that it takes away the guesswork or errors that a human can make. So basically, it's an objective way to measure all the movements of your jaw, the occlusion, the tonus of your muscles that pertains to chewing, and it also listens to, using sonography, listen to your joints for any clicks or pops or any kind of grating noises that it may make in all different positions and movements of your jaw. So basically, we can have all the information that we could possibly need to put the bite back into optimum bite without having to guess or using trial and error, which is how traditional dentistry has been done.
So let me ask you a question. We're talking about the TMD, and we're talking about temporomandibular joint problems as they relate to malposition, abnormal relationship between one structure and the other. And even though this has nothing to do with our program today, my question is simply this, knowing the answer to it, I'm going to ask you anyway, is that if somebody has bad vertical dimension, and it's been done as a result of dentistry that probably might be inappropriate, or dentistry that was done wrongly, can they end up with, because of that, now we'll set aside all kinds of other things, can they end up with a sleep apnea condition?
Yes, that is actually one of the symptoms of TMD. You can definitely have a vertical dimension that's overclosed. Their bite would cause their soft tissue structures, such as their tongue and their retropharyngeal area, to fall backwards and close off some of the airway. And of course, when you lay down, that will get even worse. So that could definitely be a cause of sleep apnea for some patients, which is obviously very, very important to their health.
My guest in studio, Dr. Michael Chung. We're talking about temporomandibular joint disorder and dysfunction. Dr. Chung owns and operates Soft Touch Dental in Oakton, Virginia. If you'd like to talk to him, 703-319-6990, 703-319-6990, and just tell him that you're a Dr. Tom Roselle listener, and guess what? He will do a complete consultation at absolutely no charge. I want to take one phone call because we have some people who are waiting. Anna, how can I help you?
Hi. Last week you spoke to a man who had pains in his arms, and you didn't have time enough to finish. So I'm having the same type of pain probably. It's from my shoulder, like the deltoid muscle. When I lift my arm in different ways or twist the palm up or down, I feel pain that goes from the shoulder to the elbow and sometimes to the forearm.
Okay, so unfortunately, I don't have a lot of time. We're coming up to a break, but I'm going to take that question. I'm going to give you some reasons for that. It can come simply because of misalignment of the lower portion of the neck. The nerves that come out of the lower portion of the neck go to those muscles, and if the nerves are misfiring, the muscles can't work properly. So every time you try to lift them, they're only working at 70% or 80% or 85% capacity, and now they're going to be dysfunctional, and they're going to present as a pain pattern. Well, the topic we're talking about today, temporomandibular joint dysfunction. If you have bad dental work, if your TMJ is not aligned properly, then it's going to cause a dysfunctional consideration of the head, neck, shoulder mechanism, and you can have pain because of that. You can have some problems with just generalized weakness. You don't have strength to your posterior shoulders. The forward shoulders will drop down. There's so many different things. Anna, thank you for calling. We have to take a break. This is Dr. Tom Roselle. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Yep, we're in studio. 888-630-9625. 888-630-9625. That's how you find us. That's how you talk to us. And if you'd like to talk to me outside the studio, real simple, go to drtomroselle.com. DrTomRoselle. That's DrTomRoselle.com. And by the way, I answer all my emails. Sometimes it takes me a little longer, but when I have the volume of emails that come in, but I like to answer the emails. I'd like to talk to you. I'd like to help you out. So, let me know, okay? But right now you can call us too. My guest in studio today, Dr. Michael Chung. Dr. Michael is a dentist and a very specialized dentist, somebody dealing with neuromuscular dentistry. He owns and operates Soft Touch Dental. You can get a hold of him at 703-319-6990 or online at Soft Touch Dental, and it's SOFTOUCH, 1T, Dental Care, DENTALCARE.com. So either call him, and guess what? All of you Dr. Tom Roselle listeners, he'll do a very special courtesy consultation, no cost to you. Just give him a call. Just say that you caught him on the radio program, and then you listened, and that was that, okay? And we'll get it done. I want you to mark your calendars. October the 19th, 2013. Write it down, circle it. Make sure you're in town. You save the date. Why? Ageless Health 2013 is coming up real quick. You'll start seeing the advertising now the middle of May. You'll be able to go onto our website and see it, and you'll start getting things. Past attendees will start getting things from us. But it'll be October the 19th this year, 2013, and it will be held at the Fairview Park Marriott Hotel in Falls Church, Virginia. And trust me, if you've been there before, this is going to be brand new information. Again, we redo it every year. It's going to be more interactive this year. We're going to have a great time. Those of you who haven't been, have been putting it off, don't put it off anymore. You're going to go home with more information than you can possibly ever imagine to be able to help you and your family the very next day. Dr. Michael, let's talk about temporomandibular joint dysfunction and disorders and all that stuff that goes pop in the night. So, and it does go pop in the night sometimes. You open up and you go crack, clench, or you grind and you chew and so forth. But we've got a few minutes before we have to break for the news. So let's talk about the symptoms that are associated with TMD. What do you see? How do people present with this? How do you know they got a TMJ problem?
Well, the patient would know because a lot of times they would either feel some discomfort or pain when they're opening and closing. They may see their jaw deviate to one side or another when they're opening and closing. Or they may hear clicks or pops. And sometimes, in extreme cases, the jaw can even lock. But probably the number one symptom is probably headaches. And a lot of people don't associate the two together. But almost every TMD patient seems to have headaches as well. Are they constant or do they come and go? And where do they show up on the head? Most of the times it would be in the temporal area on the left and right side, or on the side of the head. That's right. But it can radiate even to the back of the head, behind the ear. But temporal would be the number one area.
Is the pain associated with this type of headache specific? Is it sharp? Is it shooting? Does it come and go?
It's probably more a tension headache. It would be kind of just a tightness around the temporal area, and it would sometimes can radiate, but it's just a constant pain probably for them.
Well, I'll ask you the $50,000 question. Can TMD dysfunction cause visual disturbances? Can it affect eyesight?
I'm not 100% sure of that, but you would probably know more of that than I would.
I know that was a cheap shot, but the thing is that we see it all the time, and that's why I asked you the question. It can, because of that temporal muscle relationship to the cheekbone, which is a sphenoid, and as it comes down, we see a lot of that. As a matter of fact, in your work, and I'll tell you about the patient later on after we're off the air, one of our patients came in, and you did some extensive work with them, and they told me that all of a sudden they had to go back to the eye doctor because their glasses didn't fit anymore, and she thought that her eyes were getting worse. And in fact, what had happened is her eyes were getting better. And so, it is the type of thing that we see because we deal with subluxation patterns, which are the vertebrae out of position and so forth. But see, here's another thing you can talk about with your patients, that if they have problems and you see the relationship with that jaw breaking down, and you can actually pick it up on the K7. There's a very specific pattern that would show because of where you put the thermistors or the TENS unit to break down the muscle patterns. It's a fascinating field to me. I could sit here and talk to you academically about this stuff all day long, but this is an area that we've got to kind of dumb down for our listeners because it's really so involved. I mean, it can cause everything from the headaches that we've been talking about to the breakdown in dental structure to sleep apnea conditions to spasms in the neck, imbalances in the shoulder. All of those things can come a result of TMD, and you do such a phenomenal job of that. We're coming up to the news and some very important information, the people that help sponsor Dr. Tom Roselle Live. So don't go away. We'll be right back. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio with a very special guest, Dr. Michael Chung, owner-operator of Soft Touch Dental in Oakton, Virginia. And we have a very special program for you, I think, today, simply because this is such a fascinating field, at least for me, because I see it all the time. And what does that mean? We're talking about the vertical dimension, if you will, of the temporomandibular joint. Where is that? It's the side of your face where you open and close your mouth. That hinge that's there, that's the temporomandibular joint. And what we're talking about is all of those things that can cause problems. Dr. Michael, years ago, if anybody had a TMD problem, a temporomandibular joint problem, and they went to certain practitioners, the first thing they wanted to do is surgery.
Correct.
They wanted to cut the disc out, that little shock absorber in between the skull bone and the jawbone. And that's kind of gone into, in very, very rare cases, does that happen anymore, fortunately, in my opinion. And because the work that you do with repositioning the temporomandibular joint and resetting it is so far more effective. But when you get that, patients will come in and say, my face feels like it's hanging. It's just, it feels tired. Or, I can't open my eyes. Or I get headaches. I get stiffness. I get neck and shoulder pain. I get earaches. Sharp shooting earaches. And they go to the doc and there's no infection. There's nothing. But some of these docs will just write them a prescription just because. And it has nothing to do with that. It has to do with the position of that TMD or TMJ. And we're talking about all the disorders that follow up because of that. Talk to me a little bit about the fix. If we have these patients who come in and they're they have even ringing in the ears. We forgot to talk about that.
Right.
High vibratory sounds or low sounds that can cause either one. But the jaw joint, the TMD, the pump handle of the skull, as I call it, can cause all these things. So let's talk about that, and let's talk about what's the fix. Is the fix something that's difficult? Is the fix something that once you fix it, it's permanent? How do you fix this thing?
Right. Well, a lot of these symptoms can be alleviated, obviously, by pain medicine, and which is what most medical doctors would give you as a fix, but really it's not a fix. It's great medicine, and you'll feel better temporarily, but once that wears off, you're back to pain again. And the only way to properly fix that is to get to the root cause of the problem. And it's usually misalignment of the jaw. It's usually the muscles that are spazzing and they're very tight, and in some cases it's impinging on the nerves. So the way we can fix the problem is to find a way to relax these muscles. And once we figure out the actual alignment by using the K7 program, we can actually make an appliance called an orthotic. Once you wear that, you can orthopedically reposition your bite so that you can comfortably allow the muscles to hang and relax, and eventually the pain relief.
Dr. Michael Chung is my guest in studio. Soft Touch Dental is his operation in Oakton, Virginia. If you'd like to get a hold of him, you call 703-319-6990. That's 703-319-6990. Go online at softtouchdentalcare.com, SOFTOUCHDENTAL, care, CARE.com. And Dr. Michael has graciously offered a courtesy consultation for any of Dr. Tom Roselle Live listeners. And trust me, I don't go out of my way to recommend people, but this doctor, his staff, they're the top of the mark. They are as professional as you get. They are as artistic as I've seen anybody. Michael is an amazing, not only doctor, but mechanic and artist when it comes to fixing things, and they stay fixed. And let's talk about that, Mike. Let's talk about the actual fix. What are the choices that people have when they come into you?
Well, they have several options. Obviously, the first thing we need to do is get rid of the symptoms and get them comfortable again. And that's where that orthotic that we just talked about. But obviously, you will not want to wear the orthotic for the rest of your life. So yeah,
that's pretty ugly.
Yeah, well, it's not as ugly as you might think. It's a clear material that's like a retainer.
No, I'm talking the one you put in first, the temporary one before the one comes back from the lab with all the.
Right.
No, I'm kidding you. That's right.
But as a permanent fix, most of our patients will do orthodontics because if you can find the spatial relationship of your upper and lower jaw, and your teeth do not meet there, then you can orthodontically move your teeth to that position using that orthotic as a guide. And some of our patients who are in need of a lot of dental work or is not happy with their smile, we can actually do what's called a full mouth rejuvenation, where we can rebuild all of their teeth using porcelain veneers or porcelain crowns and fix their teeth to that correct bite position.
And you did that with Sue, with my wife.
Yes, I did.
And, Sue has been the worst grinder and clencher. I mean, sleeping with this woman, once she's out cold, is like ridiculous. I mean, you can hear her grind 2 blocks away.
Right.
And she clenches down. But you fixed that, and I appreciate it, and I thank you, Michael.
Oh, you're very welcome.
I mean, you've made my life a whole lot better. I can actually go to sleep and not be waking up in the middle of the night by this, this grinding that takes place. But no, seriously, the work was beautiful, and but it did eliminate all those conditions. And Sue's mouth now, when she wakes up in the morning, is fully relaxed. She doesn't have that tension behind her head. She doesn't have the frontal headaches that she would get if she was stressed out, if she was in a bad situation or whatever. But what we're talking about is the inability of the body to adapt towards occlusive type of conditions, and it presents itself with the things that we've been talking about, with ringing in the ears and pain in neck and shoulders, pain in the face, sharp shooting pain sometimes in the eyes. All these things can come about as a result of this condition. And so many of you end up going to other doctors, and they're giving you anxiety pills, and they're giving you antidepressants, and they're giving you Motrins, here, take this, and you're burning holes in your stomach, and you're eating. It's like, come on already. There's ways of fixing this stuff. We see our patients, and we refer to Dr. Michael, and when we get to that place where we know that it is not only a structural problem and things that we're dealing with, but also one that has to deal with the jaw, this is the guy that does the fix for us. And he has as I said, graciously offered to consult with you. If you want to find out if you have a problem that can be handled, no obligation whatsoever. This is like the easiest guy in the world. You have no idea how easy it is to deal with. Give him a call, 703-319-6990, and tell him that, you heard him talking on the program today, and you want to talk to him, and you want to see if there's a problem that he can fix that you've been suffering for a long time. It's a doable deal. It's something that you can fix. You don't have to live with this nonsense for the rest of your life. Let's talk a little bit more about the corrective phase of this, Michael. Particularly, there's some patients that say, listen, well, I want the splint. That's all I want. I'm fine. It's just when I wake up in the morning, I got a problem. And, you have some bad approximations of vertical dimension problems with the mouth, and you got to fix those, though. And then ultimately fix that splint so they're not crunching more, they're not breaking their teeth down, and so forth. How does that go?
Yes, well, the patient would basically wear this orthotic for about 3 months, and we'll be able to usually tell in that 3-month period of time whether this neuromuscular dentistry is the actual root cause and can be fixed for all their problems. And if their muscles are totally relaxed, most of the times they will not be, grinding anymore or clenching, and their muscles are able to relax. So those patients, like I said earlier, would either go into braces or rebuild their mouth in porcelain. Some of the patients actually, it could be just simple as equilibrating the bite, just making some adjustments here and there, and that's all the patient will need.
Let me ask you a question. A lot of people are going out now, and over the last 10 years, it's gotten much more sophisticated, but they're doing implants. And implants, particularly in our business, when we're taking films, we see implants that the bone density has shifted, so the implant's shifted. Or you're putting a crown in, and the crown is set in place, and the crown is off center, not sitting completely the way it's supposed to. Now, a lot of that has to do with what we're talking about. You can identify that, and then you can fix those things as well.
Absolutely.
In addition to what you're doing.
Absolutely. K7 is a wonderful thing. It can analyze all those things and would be able to objectively figure that out.
K7 is really cool. I've had it done, and they put these little electrodes on multiple places on your face and your neck and your shoulders and so forth. It's a TENS unit, and you sit there for about an hour, sometimes more to 2 or more, and it's tap 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 tap, and you're relaxing, you're listening to music, and you're doing whatever, and it relaxes all the muscles so they can get a proportionate, normal dimensional state of your temporomandibular joint where it should be for you. And we talked about earlier that the TMJ, the jaw itself, the mandible, is, I affectionately call it the pump handle of the skull. It moves the 22 bones of the skull. The skull has 22 bones that work like a tongue and groove, and they move back and forth as you breathe in and out. But if the TMJ is locked, or it's in a bad place, if the vertical dimension is off, it's shifted on one side over the other, your skull bones lock, and they can't synchronize properly, and that's where a lot of these problems come from. And I see some of the work that you do, and it blows me away. It's amazing to me how these things come about. Let's go back and talk a little bit more about respiratory problems in bad dental fitting. You see a lot of people that suddenly, don't breathe well at night. Not only sleep apnea conditions, but snoring patterns and so forth. That's part of this as well, isn't it?
Absolutely. Most of the TMD patients will have a retruded mandible, retruded soft tissues, retruded tongue. All those things would obstruct the airway, and that would obviously get worse when they're laying down. And we see this all the time with TMD patients.
Do you ever do anything with children with these types of things? There's kids who have narrow palates, and there's kids who have, in early stages, they've had bad dental work done, so their mouths are beginning to shift. When is too young to bring a patient to you?
I don't think it's too young. If a parent suspects any of these issues, I think it would be as simple as bringing them in, at least for even an observation. But a lot of times you can intervene early on where you allow them their soft tissues in the palate and everything to develop properly so that it will not be a problem down the road. There are lots of orthodontic intervention that you can do early on without having to wear the full braces later on.
Wearing braces, it becomes a social thing today, particularly with kids. Everybody's going out and getting braces done. Sometimes I think, obviously, they're applied inappropriately. And unless you're going to a dentist that understands neuromuscular positioning of the vertical dimension of the TMD, the temporomandibular joint, TMJ, that can be wrong. I used to have, and we still have a rule in our office, any child that is going to, or any adult that has dental bracing, orthodontics done, they've got to come to us before they go to the dentist to make sure that they've got good position of the neck and shoulder area, and then they also have to come immediately afterwards so we can take the stress off of it, because when you malposition that jaw, and you don't, a lot of dentists do, unfortunately, there's going to be a huge ramification neuromuscularly throughout the whole body. So you've got to watch both ends of it, and to not do that is criminal. Dr. Michael Chung, my guest in studio. We're talking about neuromuscular dentistry and TMJ, temporomandibular joint, and temporomandibular joint dysfunction. We're going to come back, and we're going to wrap this up a little bit, so don't go away. We'll be right back.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been in studio, 888-630-9625. If you'd like to talk to me off the air, real simple, go to drtomroselle.com, drtomroselle.com, and send me a note. And by the way, go to that website, and it's set up for you. It's set up for your learning, your interactive ability to apply things to your life, to the life of your families, to make your health and wellness far more exponentially better than what it is right now. Do that for yourself. Do it for your family. I mean, it's a learning capacity. And save the date, October the 19th, Ageless Health 2013. It's going to be a day that can save your life and add years to the life and quality of your family and everything that you do. This is a day that is amazing. We have everything from exercise demonstration to some of the most lively, interactive presentations from our doctors. We have a Chinese martial arts presentation on Tai Chi, but this year we're going to do some interactive things. I think you're going to find it really fascinating. Remember, every year things are different. So join us. It's going to be at the Fairview Park Marriott Hotel, October 19th. You'll start seeing advertising within the next 2 weeks. We're ready to rock and roll with this thing, so set the date aside, make a commitment, bring your friends. We'd love to have you. Dr. Michael, let's talk a little bit. Let's wrap this thing up, because this is not only fascinating, but it's a very important presentation. Temporomandibular joint dysfunction is something that in many cases goes unrecognized, not only by doctors, traditional family practitioners and so forth, but also from normal dentists that are out there, the general dentists. So I got a quick question for you: is why is that? Why don't they recognize that's where it's coming from? And then I'll ask you the second question after you're done with that one.
I can't answer for them, but my guess is that they don't know that there's a treatment for it. So a lot of times, while you have it, let's live with it. And a lot of patients and, as you said, even some dentists and doctors don't know that there's a cure for it.
Yeah, that's what I like about you. You're very kind. I'm not, you are. But that's a good thing. See, I have to have somebody that buffers me all the time. But the bottom line is that here's my view of this whole thing, is that as physicians, we are obligated to continue to understand the neuromechanics, the neurophysiological presentations of what the body does all the time, and the far-reaching ramifications. And so when something happens, and I tell my listeners all the time, never believe anybody, including me. What I want to do is provoke them enough that they could do their own homework. They get out there and they get to understand. Did he really say that? Yeah, he really said that. Do I believe him? I don't know. Let me get online. Let me do the homework. But anyway, if you'd like to find out if anything can be done with this clicking and biting and pain and ringing the ears and any of those things that you're suffering with and have been suffering from a long time, call Dr. Chung, 703-319-6990, or go to softtouchdentalcare.com and make an appointment, and he will give you a courtesy consultation and, find out if something can be done about it. You owe it to yourself and you owe it to your family. Dr. Michael, thank you. We'll have you back again.
Thank you very much.
I appreciate it. You're listening to Dr. Tom Roselle. I will see you next week, same old place, same old time, 12 noon. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.